there is that the blood supply, either to the testis itself or the blood supply to the intestine, can be kinked by the intestine stuck in the processus vaginalis, in the hernia sac. And either the testis can be damaged or die, or a loop of intestine can be damaged and die. So when we have a baby who has what we know to be an inguinal hernia rather than a hydrocele, we would schedule surgery to fix it, hoping to repair it before it incarcerates, before the intestine gets stuck.
If a child has an inguinal hernia on one side, what are the chances of having it on the other side?
The answer is that it depends at what age the baby first presents with an inguinal hernia. If you have a premature baby who in the nursery has an inguinal hernia on one side, it's virtually 100% certain that there's a hernia on the second side, even if you don't see it. So when we operate on premature babies with hernias, we almost always operate on both sides. If you have a full-term baby, that risk may be down to 96, 97%. And as you get older and older, the chance that there's a hernia on the asymptomatic side, in other words, the baby presents with a hernia on one side, but nothing on the other that you can see or feel, the chance that there's a hernia on the side where you see nothing drops. So if a baby has not had a hernia that anybody has seen, mother changing diapers, father changing diapers, pediatrician, and the baby gets to age 1 and a hernia appears, the risk that there's a hernia on the asymptomatic side is about 60%. At age 2, the risk is about 40%. So pediatric surgeons have, over the course of time, come to slightly different decisions and have slightly different opinions about what the right thing to do is. I think that it's safe to say that the majority of pediatric surgeons, probably 3/4 of pediatric surgeons, would operate on both sides of a tiny baby who has an inguinal hernia. The reason for this debate and the discussion is you're making a balanced judgment about two different risks. The risk that there is a hernia that's there, that's going to need an operation at some point anyway, meaning another trip to the operating room, another anesthetic, versus what's the risk of doing two sides at once? And the answer is the risk of doing two sides at once is relative. Every time a surgeon makes a cut, there's a risk of infection, small risk, but a true risk, a risk of bleeding, a risk of injury to some surrounding tissue. So even though the risk is small, we always have to balance that risk of doing an operation which may or may not be necessary against the risk of having a hernia that then will require being fixed later. Nowadays, there are some surgeons who actually do a laparoscopic exploration of the contralateral side. What that means is that if they're operating on a hernia, they take a little telescope, maybe small, much smaller even than this pen I'm holding, and I'm going to show you on the picture. What they do is they stick the telescope into the baby's belly through the side where the hernia is, through the little hole, and they look on the inside to see if there's an opening on the other side. Some surgeons don't do that because they feel that the visualization, the view through that telescope at that angle, is not so good. And so they would rather, they would rather just judge on physical exam, or there are even a few surgeons who feel that there's no reason to ever explore the other side unless a hernia actually appears. So there's some debate about in which situation you should fix both sides rather than just one side. Now, as a general rule, repairing an inguinal hernia in a child is a pretty straightforward operation. It takes about half an hour of operating. It's a relatively straightforward operation. The risks are the risks of any operation. As I mentioned, there's the risk of infection, surprisingly small, much less than 1%. There's some risk of damage to the blood vessels and the vas deferens, which go to the testis on that side. Again, that risk is much less than 1%, but it is a risk. And there's some risk of bleeding. Again, a tiny risk, but it's a concern because sometimes babies have problems with their coagulation, with the way their body controls bleeding. And because they're little babies, they haven't had accidents yet, they haven't been to dentists yet, and so that problem with their bleeding may not be discovered until they go to the operating room.